Good day everyone. Today we are talking about toxemia of pregnancy or hypertensive disorders of pregnancy. The classification of these are pre-existing chronic hypertension, differential diagnosis of preeclampsia, complications of preeclampsia, treatment of preeclampsia, and eclampsia. Pre-existing chronic hypertension. Hypertension is present before pregnancy, detected in early pregnancy before 20 weeks and absence of vesicular mole and postpartum. The examples of these are essential hypertension or defined as high BP in which secondary causes such as renovascular disease, renal failure, pheochromocytoma, aldosteronism, or other causes of secondary hypertension or Mendelian forms are not present. Secondary to chronic renal disorders, pyelonephritis and renal artery stenosis and coarctation of the aorta, systemic lupus erythematosus, and pheochromocytoma. The causes of the said examples or the secondary to chronic renal disorder are glomerulonephritis, hydronephrosis, pyelonephritis, and renal artery stenosis. Glomerulonephritis is a group of diseases that injure the part of the kidney that filters blood, called glomeruli. Other terms you may hear used are nephritis and nephrotic syndrome. Hydronephrosis is the swelling of a kidney due to a build-up of urine. It happens when urine cannot drain out from the kidney to the bladder from a blockage or obstruction. Kidney infections or pyelonephritis typically happen when bacteria is not flushed out of the body with urine. And lastly, renal artery stenosis is the narrowing of one or more arteries that carry blood to your kidneys. Next is the secondary to cardiovascular disease. The causes of these are coarctation of the aorta, polyarteritis nodosa, and systemic lupus erythematosus. Coarctation of the aorta is a birth defect in which a part of the aorta is narrower than usual. If the narrowing is severe enough and if it is not diagnosed, the baby may have serious problems and may need surgery or other procedures soon after birth. Next is the polyarteritis nodosa or PON. Is a rare disease that results from blood vessel inflammation, vasculitis, causing injury to organ systems. And lastly, systemic lupus erythematosus or SLE is the most common type of lupus. It is an autoimmune disease in which the immune system attacks its own tissues, causing widespread inflammation and tissue damage in the affected organs. It can affect the joints, skin, brain, lungs, kidneys, and blood vessels.
Secondary to endocrine disorders. Primary aldosteronism is a condition that occurs when the adrenal glands produce too much aldosteronism. Pheochromocytoma is a rare, usually non-cancerous tumor that develops in an adrenal gland. Adrenocortical tumors is a rare disease in which malignant cells form in the outer layer of the adrenal gland. Diabetes mellitus, it refers to a group of diseases that affect how your body uses blood sugar. Effect of pregnancy on chronic hypertension. Blood pressure falls by the second trimester in most of cases but rises during the third trimester to a level somewhat above that in early pregnancy. Deterioration of the underlying disease. Maternal. Superimposed preeclampsia or eclampsia in 15 to 20% of cases. Is a preeclampsia complicating hypertension of another cause, most commonly chronic or essential hypertension. Fetal. Intrauterine growth retardation, which is defined as less than 10% of predicted fetal weight for gestational age, may result in significant fetal morbidity and mortality if not properly diagnosed. Intrauterine fetal death, which is the intrauterine death of a fetus at any time during pregnancy.
And now we are going to the treatment, the general and medical treatment. as preeclampsia regarding the following, the rest the hypertensive and observation. Pregnancy-induced hypertension or PIH. The transient hypertension is late-onset hypertension without proteinuria or pathologic edema. Next, preeclampsia, the hypertension with proteinuria and or edema after 20 weeks of pregnancy but may be earlier in vesicular mole. And next, eclampsia, the preeclampsia and convulsion.
Superimposed preeclampsia or eclampsia. Development of preeclampsia or eclampsia in pre-existing hypertension detected by a further increase of 30 millimeters of mercury or more in systolic blood pressure or 15 millimeters of mercury or more in diastolic blood pressure. Preeclampsia. Etiology. Although preeclampsia had been described since 200 years, no definite etiology is found for PIH and is still a disease of theories.
The diagnosis, sign, and symptoms. Hypertension, also called high blood pressure, is a blood pressure that is higher than normal. Next is proteinuria, is the increased level of protein in the urine. And the albuminuria is the sign of the kidney disease and means that you have too much albumin in your urine. Last is edema, is the same position from too long eating too much salty food. Hypertension, blood pressure of 140 to 90 mm mercury or more or an increase of 30 mm mercury is a systolic and or 15 mm mercury is a diastolic blood pressure over the pre or early pregnancy levels. It is a urinary protein greater than 1.3 gram or liters in a 24 hours collection or greater than 1 gram liters in 2 random samples obtained at least 6 hours apart. It indicates glomerular damage and always occurs after hypertension. Proteinuria is usually in the range of 1 to 3 gram daily, of which 50 to 60% is albumin, but in severe cases, it may exceed 15 gram. Edema. It is the weight gain of more than 1 kilogram in any 1 week or 2.25 kilogram in any 1 month. Clinic edema is present in about 2/3 of patients with PIH or pregnancy-induced hypertension. However, 2/3 of pregnant women with clinic edema do not develop hypertension. Symptoms. These are usually manifestations of severe preeclampsia. Headache is usually frontal but may be occipital. It is due to cerebral edema and hypertension. Visual disturbances, blurring or vision, flashes or light or blindness, epigastric or right upper quadrant pain due to enlargement and subcapsular hemorrhage of the liver, nausea, vomiting due to congestion of gastric mucosa and or cerebral edema, oliguria or anuria due to kidney pathology. Differential diagnosis. Other causes of hypertension, other causes of proteinuria, other causes of edema. Other causes of proteinuria. Contamination of urine by vaginal discharge. This is included by examination of a mainstream sample after cleansing the introitus with sterile water or saline or by using catheter. Urinary infection is included by a microscopic examination and culture of the urine. Congestive heart failure and severe anemia due to hypoxia of the kidney. Orthostatic proteinuria. Proteinuria is detected at the end of the day while it is absent in the morning. This is due to pressure of the lumbar spine on the left renal vein during standing. Other causes of edema. General causes is the cardiac, hepatic, renal, or nutritional edema. Local causes is the inflammatory or deep vein thrombosis, usually unilateral. Last is the pressure of the gravid uterus or the pelvic vein may produce ankle edema.
Treatment: prophylactic, curative. Prophylactic, proper antenatal care. To detect the high-risk patients who may develop PIH through the screening test, early detection of cases who have already developed PIH and examine them more frequently. Low-dose aspirin. It inhibits thromboxane production from the platelets and the I2 binding sites on platelets. A low dose 60 mg daily selectively inhibits thromboxane due to higher concentration of such a low dose in the portal circulation than systemic, affecting the platelets when they pass through the portal circulation. The prostacyclin production from the systemic vessels will not be affected. Curative: delivery of the fetus and placenta in the only real treatment of preeclampsia, as the condition are not always suitable. For this, the treatment aims to prevent or minimize the maternal and fetal complication. See before, till reasonable maturation of the fetus.